the Dandan Flow is all about human stories, and our conversations allow us to sort of get to know people better and so on, to try and understand ourselves better. Presh Pillay,
Yes.
welcome to the Dandan Flow.
Thanks a lot, Dan.
So I'm going to sort of jump in with something here. One of my big fascinations is human consciousness. And we have a sort of a consciousness that stands outside of narrative,
Yeah.
like the actual presence of being a human being. And then we have all of these amazing upper cortical structures that allow us to build incredibly complex stories, which are really cool, and it's a powerful tool, but we tend to mistake those stories for reality. And then that becomes a reality. And, sorry, I can actually sort of say a little bit more. Someone like yourself who has access and privy to certain information, to realize that big parts of that story around a certain area are actually false, and that they don't relate to reality in the way that people would expect it to. And that means that people live their lives, at least in this, and this is just a very specific area, right?
Yeah.
We'll mostly be talking about dentistry, since you're a dentist. But that people live their lives out, they make decisions, they do things in their lives based on what they perceive.
That was perceived.
Yeah, on this norm that's supposed to be, oh, this is reality.
It's almost like a taught reality.
Yeah. But then it turns out a lot of that stuff is false.
Yeah, it's actually kind of sad how it's been working throughout the years, and being, how can I say it, being a part of dentistry for literally all my life, because my dad's a dentist, I have an uncle that's a dentist, two cousins are dentists, my one cousin's an oral hygienist, my one cousin's a dental technician. So I've had the insight into
a toothy family.
Yeah. Family functions are weird. Family functions are weird. So it's like I've had an inside view of dentistry from the get-go, and I've been using that in the way that I practice, in the way that I view patients. And even though I'm not there yet as one of those crazy successful dentists, whatever, but I just know that whenever I'm seeing someone as a patient, it's not I'm seeing them in a dental point of view, I'm seeing them as a person. And that's where all the ideology of dentistry has not been, because everyone views us as dentists.
Yeah, and so you sort of see yourself as a technical resource that applies itself to a technical problem, and the people who come in and the patients are just people who have technical issues,
Yes.
and so we just mechanically fix these things sticking out of their skull.
Yes. And
as opposed to you're a human being and your patients are human beings, and you have to actually respect that.
Yes, yeah. Like no one likes going to the dentist. Okay, I'll say I like going to get my cleaning done because I may be weird into dentistry because of my family. But it's like there's a lot of things in dentistry. Like my main modality of treating patients, well, people. Let's not call them patients. It's people. Is if I can do the least I can, then I'll do it. As in, I'm not there to tell you you need this filling done, just because clinically and maybe on an x-ray it looks like something's there, but it is, let's say it is there. If you come in 6 months' time, it'll be the same filling that needs to be done, but then I'll be able to see again in 6 months, and then I'll know 100% sure something needs to be done. Because, again, I'm not a dentist, I'm a person talking to a person. A person does not want a drill in their mouth that's going at 400,000 reps per minute.
No, it's not fun.
No, I don't want it. I have my wisdom teeth in my mouth and they need to kind of be removed, but I don't want to go get it removed. So even as a dentist, I don't want to see a dentist.
So you're specifically going to your wisdom teeth here. So many directions I want to shoot into, but I know there's
it does make you slightly stupider when you remove your wisdom teeth. That's a joke because it's wisdom.
Yeah, your wisdom. But I've heard a couple of things about specifically wisdom teeth. I think there's a guy, Dr. Muse in the UK, orthodontist. I might have the story wrong, but orthodontist, his dad was an orthodontist, and they basically say that, or he says that almost no one ever needs to have their wisdom teeth removed. And that it's really a function of how we chew and the soft food that we eat and the hard palate that doesn't drop flat properly and so on. And that you could actually, by doing specific exercises, I think they call it mewing, you can actually flatten the hard palate to create that space, and the jaw, the mandible, will actually create the space, both in the top and the bottom.
So yeah, there's a lot of orthodontic ways to add space, right? But if we're looking at that, we're looking at more in your formative years. So let's say all younger than 18 when you're growing, even though you are still growing till 21, skeletal wise. Sometimes people are older, sometimes it's younger. It's not really specific number. So if we can pick that up early, we can manage the jaw and how it's meant to
And create the
be
necessary
shaped.
expansion for
Yes,
that, for the additional
but
teeth.
that's not always possible. No matter who you are, it's not possible. Like I know my skeletal structure and my oral structures are perfect.
Well,
Yeah,
congratulations.
well, that was through a bunch of orthodontics for like 3 years. So I know it is where it's meant to be, but my wisdom teeth still can't come out. Like even my second molars, which are in front of the wisdom teeth, are slightly skewed because of lack of space. That's just because of my anatomy.
Okay.
So you can't say that everyone's molar wisdoms can be out of their mouth if they treated
But so,
in that way.
I mean, if let's say from an early age, you didn't have, like most of us in Western civilization does, sort of softer food and stuff. Like if you had to chew harder and work, that shape would have been different.
No, because then we're looking at reversing. What's it? How do I forget this name now? That's like reverse engineering evolution. We losing our wisdom teeth. We're seeing less people with wisdom teeth, and I've been seeing it now, being in dentistry for 6 years, into my generation, the older generation, and the new generation. You can see how just in those three generations,
They're disappearing or becoming
yeah,
smaller,
no,
or
they're disappearing.
that is weird.
Or so that's where wisdom teeth. That's wisdom teeth as to why not many people maybe have issues with wisdom teeth anymore. Is because they don't have it, or they're very small and they're not coming out.
I wonder if there's a correlation between how people are actually losing their wisdom and
Yeah,
losing their
yeah, yeah,
wisdom
no,
teeth,
no, no.
right?
I have a feeling it is working because it seems like the younger generation are less wise.
I think it's always seemed that way.
Yeah, yeah, yeah. No, I can imagine that my parents used to think like I'm such an idiot when I look back at my high school photos, and I used to have a straightened little, emo thing going over my eyes and stuff. Didn't even know how they allowed that.
Yeah, I mean, it's interesting to think that people are not having, and I'd like to understand exactly why, because biologically, for us just not to have them, is that because there's a disruption in hormonal development because of microplastics? Is it? Well, I've got no
No, no, no.
idea.
It's honestly mostly just due to our diet. It's if you if you have a look into the history of like mankind and where we came from Homo sapiens, because
Yeah.
we're Homo sapiens sapiens. If you look at the jaw structures of everyone, you'll also notice that their mandibular bone is a lot thicker, and then also what we call cortical bone, which is the bone surrounding. So bone has there's multiple layers, but it's two layers: the cortical bone, which is the outside hard structure, and the inside, which is trabecular bone, which is softer, spongy. That's where your blood vessels are running through. If you look at back in history, the cortical bone was a lot thicker.
So to take more of a punch.
But yeah, because it literally.
Life was a bit,
Yeah.
a bit more challenging.
People were hitting each other to fuck your wife, but on a daily basis, whereas over here it's just at a pub.
It's only occasionally.
Yeah, it's occasionally, but back then it was like a daily thing. So you had to be stronger and you had to have much more bone structure to survive. And then when it comes down to eating and the food. Remember now, back in the day, they had to medium rare steak wasn't a thing because you'll get a disease if you didn't overcook your food. So that's, and remember also they were eating, people have been eating vegetables and stuff, not like how we are. We like get these things in Woolies bags, put in the microwave, it's perfectly soft and everything. They were taking a flippin' onion off the ground and biting into it like an apple. So you needed that structure, you needed that extra strength in your jaw, and by having a third molar, which is your wisdom, that will spread out the energy, the forces of biting and eating. So your other teeth don't get affected. So then as our
redistributing
diet has,
the weight,
yes.
the impact.
Yes, and then as our diet got softer and softer, then we've seen that the cortical bone structure and the size of your mandibular ramus, everything has changed, because you've definitely seen photos of, like, say, Neanderthals and stuff. And you've seen skulls of them and stuff like that, right, Dot?
Yeah, no, they look a little bit more hardy.
Yeah. They can take a punch, whereas then look at me and you. I can't take a punch. You see what I mean? So, like, it is.
So we're just evolving.
Yes, like at
evolving out of our wisdom teeth.
At some point, not near future, but like couple 100 years time, maybe our wisdom teeth will be called our second molars at the moment. Because wisdom teeth won't be a thing, which is your third molar.
Yeah.
And then your second molar disappears. Yeah.
Eventually we'll just run out of molars.
Yeah. Because we don't need them.
Interesting.
So that's the, and so that's actually where the whole, like, my whole thing of treating wisdom teeth also is, if it's not causing a problem, leave them in your mouth. And that is one thing that I would love to inform people, is that if someone tells you to remove your wisdom teeth, ask them to show you why.
What's the common story? That it's causing pressure
at the back.
At the back,
it's going to move your teeth. It's going to do all of that. I have my wisdom teeth sitting sideways. They are putting pressure on my pressure. So I don't know how wisdom teeth have this force that can come from the back and push your front teeth skew. If someone tells you your wisdom teeth need to come out because of that, there could be reasons for that. Right? Like when I do orthodontic treatment, I would prefer for wisdom teeth to be removed because it allows me to move the other teeth better. Like if
it creates that space. So
yes, so
you can juggle around.
Only if wisdom teeth are impacted, like they're sitting sideways or something, then I'd rather have them removed so I can move things around. I don't get wisdom teeth removed on orthodontic cases because oh no, it might push the front teeth skew later on.
Yeah, it's just to create the space.
Yes, it's just to create space. The whole ideology of taking out wisdom teeth because it's going to push your front teeth skew can't be a thing, because of how does something put a force so far back in your mouth to move something in the front? Like that distance in oral health is massive. And the amount of force needed is a lot.
So what you're saying is a lot of people get their wisdom teeth needlessly removed.
Yes.
And I suppose there's a bit of money to be made in that arena.
I was about to say, people have less wisdom teeth now. There's not many patients that needed wisdom. There's not, say, in my generation, next generation, people have less wisdom teeth, so then the surgeons aren't pulling out wisdom teeth.
Not enough, so they push the price up per unit.
Yeah, so then they can't afford the Ferrari or something like that. Which again, that's a whole other story.
Yeah. So that's, I mean, obviously it's not the only arena. in terms of oral hygiene or oral health, is not just the wisdom teeth. You actually told me something the other day, and sort of clung to me. You said ugly duckling syndrome.
Yeah.
What is that?
So
Phenomenon.
yeah, it's the ugly duckling phase. So it's actually like the textbook term. Like in our textbook, it says ugly duckling.
Okay.
And the way we learned it, as I remember, one of the lecturers put up a picture of literally, I don't know what the story is. Remember that there's an ugly, that ugly duck that was part of the duck group, but it was actually a swan.
Yeah.
I forgot what the story is
Yeah,
about.
I think you know the story. It's an
Yeah.
ugly duckling because it looked ugly.
It looked ugly,
but it
and
wasn't
because
really one of the ducks. It was
baby,
actually a
it's
swan.
funny because baby swans look like shit.
Yeah.
So it's like when your kids are going through that phase of when they're losing teeth and then permanent teeth are coming out, a lot of things to do with your baby teeth and your permanent teeth is to do with spacing, because it depends on how your jaw is going to be, the size. So then you'll have spaces in between teeth that you maybe didn't have, like your kid didn't have before, but now there's spaces. But then it's because the spaces are there, so your jaw grows, and so your other teeth can come into that space, and then your teeth might be slightly shifted. Like you'll see normally kids' front teeth, the permanent teeth, will have this little, we call it diastema, which is a gap in the front. So that's where that ugly duckling.
Passion gap.
Yeah, yeah. It's Cape Town. I'm sorry, I forget I'm in Cape. It's a passion gap. So it's like you'll see a lot of kids. They when their front teeth come out, they come out like pointing out with that gap, the diastema, which is the picture of the ugly duckling. Where it's like
Okay.
like that, yeah.
But so that's something. It's like you say. That's a textbook thing.
It's a
so
normal.
all dentists know this.
Yes.
Or should know this.
Yes. Well, I've realized common sense isn't common, so they should know it. But
The irony about the term common sense, right?
yeah. So
And so what you're saying is that because of this phase, this ugly duckling phase, there's a lot of orthodontistry that happens that shouldn't really happen.
yeah, there's a lot of there's times when orthodontic treatment is needed at a young age. But I can say that there is a lot of orthodontic work that is done at a young age when you could wait slightly to let the natural, because to have the body naturally move things into place will 100% always be the best.
And so, like your recommended route here for someone, let's say an 11, 12-year-old who's got teeth pointing in different directions and so on, would be try to wait it out.
Yeah, I like to, if I see that there's something called crowding, which is there's a lack of space in the teeth. That's something I had growing up because I got braces when I was 12, but I needed it. My teeth were extremely skew and rotated. So it wasn't a thing of, so that rotation is because of lack of space. But it was so severe that my body wouldn't have grown.
But could it for some people, even if you have some rotation?
If you have some rotation, I like to wait maybe, if I see a patient for the first time, if there's some rotation and lack of space, I'd rather wait 6 months to a year till they're 13.
And see if they can keep on
See if it's
creating
growing,
the
yeah.
space.
So I'll
And
take
so
my
the moment that you create the space, is it the tendency of the body to actually just
it'll naturally derotate if because your body is making space by growing, right? But your jaw is growing, and by your jaw growing outwards, that's making space for. Because if you rotate like physics wise, like if something's rotated like this, or like okay, your tooth's meant to be standing up straight, and now it's sideways. There's no space.
Yeah.
So for it to come straight, this gap needs to widen.
Yeah, but so what you're saying is the moment you create the space, the tooth's not just going to stick around the way it was.
No, it won't, because
it will rotate.
It will rotate because of your tongue. Continuously, like when you're sleeping, especially, your tongue is always
busy.
Yeah, it's moving, so it's gonna push everything into its correct place. Just normal living, your musculature and all of that, it will want to go back into that that space.
So what would you say? I mean, if we just gander what percentage of orthodontic practice, let's say braces and so on, do you think is unnecessary at this point? Or just overkill?
It is a small percentage, I'll say. It is not a, it's not like saying, oh, 50% of orthodontic cases is overkill. I'll say maybe less than 10%. But again, we treating people. 10%, or let's say 5%, or let's say 1% is overkill. That's fucking up 1% of someone's bank account. You know what I mean?
Yeah. No, I
So
understand what you mean. So you said
no matter what the number is, it
let's
shouldn't
say
be
the
there.
abuse isn't that prevalent, but the fact that there is any level of abuse,
Yes,
and
yeah,
for
yeah,
what the
yeah.
implications are in terms of how much people pay and what kind of insurance cover they can get for it, and
Yeah, like it doesn't matter as to what the percentages of the abuse happening dental wise in all dental treatment. There shouldn't be that.
yeah,
There shouldn't be a thing of I need to pay off my Porsche or my Ferrari. You're treating a living human being.
yeah, and that budget has,
Implications for,
of course, all kinds of other things, opportunity cost for that money for other things they could have
and then
done,
also
and
lifestyle changes, all of that. There's a lot that goes on. So, like a kid to have braces and things, that emotionally it's draining. I'm not sure if you had braces before.
I actually did.
It sucks.
It does.
It sucks. It's painful. Shit gets stuck in there. You start getting bleeding gums. That wire fucks the back of your cheek the whole time. It's so uncomfortable. So even if I can stop two people from getting braces unnecessarily, it's
So what is an ideal time? Like you're saying, leave it for 6 months to a year or so, maybe when someone's 13 or, so 13 is a number that you threw around, but what is, if someone can, let's say, deal with this, with a kind of social stigma of having skewed teeth, what is the ideal time for them to actually, is it better for someone to wait until they're 16?
so ideal time has, and maybe I think now with the new advancements in orthodontics, it has changed from what I was saying maybe taught in undergrad. So I have an orthodontic understanding and background. I don't have a formal postgraduate degree in orthodontics. I do my clear liners and stuff like that, but I can't really tell you what the number is because I think an orthodontist will understand that a lot more, like a guy that has specialized in orthodontics.
Yeah.
But from what I'm seeing is when we were taught, it was always you want to intervene like at pre-puberty or at puberty. But if you start pre-puberty, then at least now the facial structure is now growing at a quicker rate. So then movement of teeth in the bone
It's just
is
easier
easier.
because
Yes.
things are changing
Your
anyway.
body is anyway changing quicker. So 16 might be too late. So that's why, like, when I had it out, it was about 12, even though I've stayed the same flipping height since I've been 12. So, so
You can't have it all, Bresh. You
yeah,
can't have it all.
that didn't help. But then the one thing was definitely what orthodontics is going to now is preemptive orthodontic treatment, as in doing there's a company called Myobrace that they have systems in place where in like even a 6-year-old can be wearing something that'll widen their palate. Like if you notice the palate's gonna be shallow, they're widening the palate. They're changing the structures of actually baby teeth to allow the permanent teeth to come out in certain areas. I think it does need a bit more refinement in all sort of preemptive orthodontics because it is a fairly new system, fairly new ideology.
Approach. And,
Yes,
yeah.
but I've seen a few cases, especially working with Dr. Farasida at Crumbum Dental, on a case that she's working on. In I'm not saying it was a 6-year-old, but like just to see the difference she's made in like a preemptive orthodontic treatment in honestly 6 months is unheard of, because everyone would have said this patient should wait till they're 12 to get orthodontics.
Yeah. And what is that? I mean, now I'm intrigued. What does that look like? Is it
No,
something?
like braces, like normal, like I'm not talking about Myobrace or anything. I'm saying like actual braces, but on like certain teeth that are skew, and like you kind of narrowing your approach to the teeth that are problem now, because obviously at a young age you have we call it mixed dentition, so that's permanent teeth, baby teeth, all in the mouth,
Yeah.
and sometimes the permanent teeth come out skew, but they are very skew that they're not going to really straighten themselves. Like as a dentist, we know what's gonna, like a lot of times I tell patients your kid's gonna need braces. So just start saving up now. Even though the kid's like 7 years old, 8 years old.
Yeah.
You can tell. But then now what we now have been exposed to is that like there's a way to put braces, but like on these teeth that are skew, even though it's mixed dentition, and then straighten those up in the meantime while we're waiting for the rest of the teeth to come out. So it's like a much more specific in one area, straighten those so that at least braces later on, like the patient will still need braces later on, but braces will be shorter time limit because
You're already sort of putting things in place and creating
yes,
space
even
and
though it's a longer treatment plan kind of, because you're starting at a younger age, but then because the bone is also not so hard at a young age, it hasn't been fully ossified and everything like that. Those movements are quicker, so it's kind of more comfortable for the patient. Also, pain wise, it's a lot less. So that's been a cool thing that I've been exposed to, and it again that
but
can be um, taken advantage of if you're
yeah.
not a patient or a patient orientated dentist, a
Yeah.
people orientated dentist. That can be taken advantage of because now people will start placing these things in on a kid and then still making money of doing the braces later.
Yeah. Yeah. So the thing about this experimentation, like trying new things, obviously we want that because that's how we have progress. But I always wonder, I mean, the nature of science is that you need some kind of control, right?
Mm.
So to say, oh, we have these two kids, this is what their teeth, they both have. I understand this is difficult because there's unique biology involved in every person, but if you have two kids and you say, oh, their teeth look the same, let's try this intervention on the one and then see what the difference is and what the difference is going to be later on. You're saying like, a 6-year-old or 7-year-old or whatever. How much of that do you think is actually happening in that way, and how much is just, well,
No, a lot, no, a lot, a lot. To be able to start doing new processes in dentistry, the tasting process is extensive. Um, it's there's a lot of behind the scenes that goes on that we don't, even as dentists, don't even know about. Like these processes have been started 10, 20 years ago, but then only being allowed to happen now.
yeah. So I understand that in the medical profession, that typically sort of senior internists and so on would actually go and disseminate the information about new medicine or new procedures and so on to other
Yeah.
doctors. You have something like that in dentistry, I'm guessing.
Yeah, so there's always it's so if you in a specific dental industry, like have some sort of even if you have a passion for, let's say, orthodontics, because we're talking about orthodontics, some sort of passion in that, you will always hear these small little stories coming out from the woodwork as to, okay, this is a theory that people are thinking about, and
And then once something is published and peer reviewed and so on, and everyone can look at it, then it can become an
it can become
accepted
yeah.
practice.
But the only thing is that for something to be like, it can be peer reviewed and can be agreed upon. But then now, remember, we're treating people. So then to get the legality of it to be allowed is then another process. Whereas something can look good in paper and will work, but you still need the practical side to be tested, and when the practical side is tested, then you're going to look at each country's ethical boards and their ethical laws of how it can be introduced into dentistry. You can say like the ethics in South Africa is different to the ethics in Uganda.
Sure.
You know what I mean? Like,
Yeah.
but like dentistry wise, I will say South Africa is we definitely are on like even though you get like the Americas, you get European countries and stuff that do have great dentistry, but we on the same level, honestly, as most of the world, in the way that we
And
treat
so
patients.
in terms of pricing and
Bro, pricing is actually ridiculous. We so cheap for doing the same. Like, how can I say? I did a crown for a patient last week, and he's from America, and he just had a crown done in America. That same crown, he didn't like the way it looked, the front tooth, and he had that crown done 2 months ago in America. And then when I told him what's my price, and it's literally top of the range equipment, as in he didn't even experience the technology that I was using, the attention to detail that I was doing, the sort of treatment plan that I was doing just for this one tooth. He didn't even experience that in America, and honestly, like a third of the price. Like he was just like, yeah, no, it's fine, do it. Yeah, like
okay, so maybe we become sort of a dental holiday destination.
that's the plan. That the plan that like the one thing that I've been thinking about. I'm not gonna say it on this because I don't want other dentists to steal this thing, but
Okay.
I have a plan in place to make it a dental tourism kind of practice, but it's not going to be like say getting turkey teeth. People go to
Well,
Turkey.
for hair and
Yeah.
kinds
Everyone
of
goes there.
cosmetic
Yeah,
surgeries and
no,
things.
like I've had quite a few patients that have come to me because they got dental work done in Turkey, and then 1 year later shit starts failing, and then
Okay.
it becomes my problem to fix it, and then like the weird thing is like then you get patients like even though I'm fixing their problem, then they get angry at me for not being able to, or not say, oh, I'll be able to fix it, but then the fix is kind of it's not the best treatment modality, but it's the only way to fix the problem. And then they'll get angry at me for not fixing it 100%. Then I'm like, well, fuck off back to Turkey.
Yeah.
Let them go fix it for you and see what they do. Like, if you're gonna be cheap in dentistry, so that's the other thing. Is like I am treating people, so you need to make sure that you're doing the best for the people. But the one thing that I have to tell people is like if someone can't get this like understanding of what your oral health and what your teeth mean to you, even though something might be cheap, doesn't mean it's gonna work. Because in my thing of how I practice is if I'm doing something for you and it costs you 10,000 rand, that 10,000 rand needs to, let's say, minimal cost you technically 1,000 rand a year, so 10 years.
Okay. I follow what you're saying.
Yeah, so I'm not going to do something for 10,000 rand if I can only give you 2 years on it. Or I'll do it, but let you know.
Yeah, make it very clear that
Yeah,
this
make
is
it very clear. Like I am doing something that is going to fail. Like I tell patients like if I can't give him let's say that 10-year period, I don't tell them it might fail.
you tell them it will fail.
It will fail. So you make the decision because there's always another option.
So just give me an example here. I've been fortunate enough that I don't spend lots of time at dentists with things that will fail in 10
Yeah.
years' time. Like what kind of things
So
are
let's
prone
say
to a failure?
yeah. So Let me come back to like doing a crown, like that's a cap on top of a tooth, okay? But to put a cap on top of the tooth, the best way that a cap will bond to a tooth and last long is if there's enough natural tooth structure, right? But then you obviously get teeth that are messed up, that maybe are just broken down flat to the gum, right?
So you don't really have enough surface
There's
to...
not a lot of natural tooth structure and healthy tooth structure available. I've done it many times where you can place something called you do a root canal on the tooth where you take out the nerve out and you fill it with specialized material, and then you place something called a fiber post inside where you do the root canal, and that gives it rigidity, and like there's a little piece of post sticking out of the tooth, and then you build the tooth up naturally with filling material
around that post.
Around the post, and then you can do something called a gingivectomy or crown lengthening, which is taking away gum tissue and maybe a bit of bone around the tooth, and then putting a crown on it, which is a good, depending on where you're going, let's say between 12 and 20,000 rand, right? It works well. I, touch wood, haven't experienced I've had a failure on those teeth, and I've been practicing 6 years, right? But all those people that I have done this on, I told them it will fail in 2 years.
Just so they can start saving
up for an extra. I tell them, listen, in this 2 years, you're going to be saving up for an implant. That's it, because the only next point of this tooth is taking it out and putting an implant in.
Yeah. So you mentioned part of that process would be to do a root canal. I've heard some terribly scary things about root canals, including that, from what I understand, again, please correct me, that one of the things that tends to happen is that anaerobic bacteria gets stuck at the bottom of the root canal, and that starts to actually affect the rest of the body. And obviously anaerobic means it doesn't need oxygen, so it sort of goes where it wants to and does what it wants to and can cause different kinds of knock-on effects. Is that something that you're aware of? Is there a way to try and mitigate that?
So the best way to mitigate that is just brush your fucking teeth and floss.
Okay.
And don't get to the point of needing a root canal. Go to the dentist twice a year, get your checkups done. If the dentist tells you need fillings, get that filling done. Because you don't want that decayed tooth structure. Like, a lot of things, people don't go to the dentist, they know their tooth is broken, but they don't have pain. No pain doesn't mean there's no issue. Ask a bunch of cancer patients that didn't know they're in third stage cancer until they went for a random general checkup. You know what I mean?
Yeah. So I understand. So what you're saying is just your discomfort isn't the only gauge that you should use to decide whether or not there's intervention necessary in your mouth.
100%. But then now you're coming back to the anaerobic bacteria and things. Most dental infections, like when you need a root canal, what happens is there's multiple reasons for a root canal, but let's say the most obvious thing is bacteria got into the tooth and into the nerve structure. Okay? That'll be your aerobic bacteria and anaerobic bacteria that gets into the tooth structure, okay? It infects the nerve gets infected, and that follows the nerve structure into the tooth. And where's your tooth sitting? It's sitting inside bone. So then now that bacteria now goes through the tooth, you might have high sensitivity, high pain, you might not even have anything. And then it goes into bone, and that will cause an infection in the bone. That'll be a cyst or there's a lot of, I'm blanking on all the dentistry technical terms because
it's one of those days.
No, practically in dentistry, I'm brilliant, but I asked my assistant to bring that thing for me, and she just knows what that thing means. I don't know the name of the thing.
What's the name of that thing again? I know the feeling.
So but my assistant 100% knows exactly what I'm talking about. She's like, okay, she'll get it.
Yeah, like the thingamabob with that one.
There's multiple things that I know that she knows that's different things, but she knows what I'm doing, so then she knows what thing I need.
Okay.
So, um, so when you're doing a root canal, I'm very root canal. I have a big interest in root canal therapy. Okay, because a root canal is saving a tooth from being extracted. Instead of a lot of so it's saving a tooth that needs to be extracted. Okay, because once the nerve tissue is infected and you haven't, say, abscess or cyst or whatever, you only have two options:
Yeah, to pull the tooth.
or to get a root canal. Okay, a root canal can fail. There's always anything in dentistry can fail, right? But the reason why, let's say you have an abscess there with a bunch of anaerobic bacteria in there, if you have that abscess in there and you take away the reason for the infection, which is the nerve tissue, it's infected, your body will then take away that abscess or infection because there's no reason for that abscess or infection being there. Okay, but if you leave tiny traces of bacteria inside the root canal, in the tooth structure, in the nerve chamber, then there is still that reason for that infection.
Yeah,
Right?
so it creates a little hotspot for them to breed.
Yes, and then it comes back. But the way we mitigate that is by doing root canals to the textbook. As in, there's a lot of procedures in dentistry that you need to kind of veer away from textbook dentistry because it won't work like that. You have to somehow think laterally.
Yeah, find a way to fix the problem.
Yeah,
It's a little bit of lateral thinking.
MacGyver your way through it.
Yeah, the thought of someone MacGyvering their way through my teeth is terrifying.
Yeah, no. Like I've done a few MacGyver things even in the past couple of months. I tell the patients before I do anything, I'm like, this is now MacGyver technique. This is nothing like that. Like I've had a few. The weird thing is like in the past 4 months, I've had multiple people with the same issue where a front tooth just breaks in half, like onto the gum level, and then they need it sorted out because they have like a meeting tomorrow. So then now, like my last patient, I told them it's not MacGyver technique anymore. It's actually what I fucking do.
It's been formalized in the book of Presh.
Yeah. It's the Presh technique. Like it's been weird. Like I've just had so much. So like I'm so comfortable doing it now. Whereas when the first patient that came in, I was like, okay, shit. I don't know how long this is gonna last you. It might last half an hour, but I can do it. Now I'm like, oh, this might last you like long. So, but then when it comes to root canals, getting back to that, it's how you clean up the chamber. You need to make sure that it's we'll never be able to get to 100% of taking out bacteria.
But there is a textbook way of trying to ensure the highest possible.
Yes, and that textbook way is not followed by maybe 95% of dentists.
Oh, well, that's terrifying.
Yes.
And so-
I can. People are probably gonna have fun with that little stat that I said. Well, fuck them because I know what's being done around there.
Yeah, so what do they typically do? I mean, what part don't they follow? Is it just sort of
There's
and why? I mean,
it's time consuming. It's time consuming, and the other issue that we're having in dentistry in South Africa is with our medical insurances. They're not paying us enough for what's been done. So then dentists would rather than maybe not give you 100% of what the treatment needs and give you 70% because it reduces their time so they can see another patient.
because insurance won't cover the actual cost of doing it properly.
No. They'll cover it, the full thing, but the amount is so little for your time that it's not worth it. From a financial point of view, which is a massive thing also, because we as dentists still need to make money. Like how can I say it? Medical insurances. Not gonna name any names, but what's the cost of living? It increases every year, right?
Yeah.
What's that percentage? It's your, again, blanking on.
Not
Anyway,
just interest
your
rates.
interest rate, yeah. So, since I've been in private practice, 6 years now, what's been happening, medical insurance has been increasing. One specific one I know, won't say anything, but you'll discover at some point. Increase their dental rates by 2.5% a year. Like, how is that even allowed? So that means we need, as dentists, even though our costs are increasing by close to 10% a year, we only getting an increased pay of 2.5%.
Yeah.
So
And the
then,
danger, like you said, a big danger of being underpaid for a procedure like specifically a root canal is that someone's going to start cutting corners, and people possibly do.
no, everyone does because we're not getting paid enough for our time.
Yeah.
Whereas, like, if you do a root canal properly, you're looking at like 2.5 hours of your time. But then, if you're doing it properly, then you're charging. You're not using medical aid. You're not charging in medical aid rates anymore. Now you're charging in maybe double medical aid rates. But you know it'll last. But then patients aren't happy that you're charging so much.
Yeah.
But then we need to charge that much because we are doing that much more.
Because that's what your time is worth.
Yes. So that's like the catch-22 of dentistry in South Africa at the moment, is that we also aren't being appreciated by patients when we are doing proper work.
Yeah.
Whereas they will say that, oh, they can go somewhere else and get it done for this price. And then I just tell them, that's fine, go there, get it done at that price, and I'll see you next year.
Terrifying.
Yeah. Terrifying that people don't know this, but also, again, in South Africa, most 90% of people can't afford a root canal done properly.
Yeah. No, I understand, because you do it properly, like you said, it's like 2.5 hours. And yeah, that's a bunch of money.
Yeah. So, but then 90% of people can't afford
Yeah.
that 10% of dentistry.
Sure, I think 90% of people can't even afford the botch job.
Yeah. So it's like it's such a weird area in healthcare right now when it comes to dentistry. Like I
Yeah.
know of actuarial scientists that obviously work on price points and things like that, and in your insurance, in your life insurance, and your medical insurance, they kind of work on that. And I know from first-hand experience that, well, not first-hand, well, I know a bunch of
The
people in the
actuaries.
field,
Yeah.
and when it comes to medical aid, one of the main things that is cut, and price points aren't increased, but they normally cut, is dentistry, the first one.
Yeah. I mean, it's surprising to me. Well, it's not surprising in some ways, but I think it's your oral health is quite important. I know you've got a microbiome in your mouth as well, right? But if it's not healthy, then you're going to have all kinds of other health issues,
Yeah.
right? If your mouth is in a terrible state, then the rest of your body is going to have a tough time. It's sort of, the worm only has two ends, and it's the one end of the worm.
Yeah. No, it's funny you say that because it's like I had a patient, a few weeks ago. So this guy, I've seen his wife, and then his wife told him, just come see me because he hasn't been to the dentist in very long. And then he came through, and then he needed a bunch of work done. One was a root canal. But he had like a long-standing chronic infection there. So the body, he never had pain, but he had an infection in like an abscess or a cyst growing there, right? But he didn't have pain because the body controlled it.
But that means his whole body was out of whack because
When
of this
I finished the root
continuous.
canal, He came to me for the rest of the fillings that needed. He's like, dude, his brain fog is gone. His energy levels are up. It's been years since he's concentrated like this before.
He's just been poisoned all of that
Yeah,
time.
he's just been his immune system has been on continuous high alert that it's been taking away energy from the rest of his normal living.
And that's an infection that didn't cause any pain or discomfort.
No, again, come to the dentist, because you might have something there that needs immediate attention. And like I've had it, like floss. Use floss. Just floss your teeth. Because if you don't floss your teeth, everyone says it's flossing your teeth. Sorry, you're not flossing your teeth.
Flushing the gums.
You're flossing your gums. And then people are like, oh no, but I'm cutting my gums, that's why they're bleeding. No, they're bleeding because your gums are inflamed and infected. Like another thing that I'd love everyone to take away from this podcast is, if you start flossing every day from today, just give it 7 days. Today's going to be painful and hurt and bleed. The next 3-4 days, you're going to be swearing me, saying like, this Dr. Presh doesn't know what the shit he's talking about. I can tell you now, on day 7, your gums won't bleed and they won't be so inflamed. You might have periodontal disease, which is a whole other issue where there's bone loss and things like that. But just your gum health will have such a major difference in 7 days, just if you floss every day from now.
Okay.
Yeah, like it's such a simple concept. Because again, by flossing your gums, you cleaning out bacteria that's right in the area of where your bone is around your teeth, right? We can fix things.
Once they've gone wrong.
We can fix things that are in the teeth, right? But if you lose enough bone, like I can MacGyver a tooth. Dentists can MacGyver a tooth.
But once you start having serious bone loss...
MacGyvering bone loss?
Not so much.
Not so much. So by flossing, you're actually making sure the foundation of your teeth is healthy. And it's such an important thing to do.
That makes a lot of sense.
Yeah. If the base isn't healthy, I can give you the best veneers in the world. You'll have amazing teeth, but you're going to lose your teeth in 5 years. What's the point?
They're just going to fall out because there isn't bone to hold on to.
And that's the other thing, is that a lot of dentists do that. A lot of dentists will go and do your smile rehabilitation and give you a great smile. But then the foundation of your teeth is fucked. So then how does that make any sense? You as a dentist is there to treat the person. You need to tell them, shut up. Your smile's been looking like shit for 40 years. You can't wait a year before we do your new smile.
What do they do during that year? Is there some...
No, we do periodontal treatment. So we either send you to a specialist, or I do perform it. It's something called root planing, or they might have to go to a specialist, just get like the gums opened up.
To actually build up the bone.
Build up the bone, not too much, but more clean out the bone so that there's no further bone deterioration.
Okay.
So we can keep the healthy bone there to hold the teeth in, and then teach you how to manage it so it doesn't come back. But to add bone to healthy teeth, it can be done, but most of the time not really.
Yeah, I've heard stuff about this remineralization, that you can remineralize, and I understand, obviously, there's something that's still fairly new, and it might also just have been clickbait. But it looks like there are things that they can actually put on your teeth, and your teeth can remineralize, and you can have cavities that would actually close up.
Yeah. So I would say remineralization occurs a lot in teeth. There's something called so you get 2 types of tooth decay: affected and infected. Okay. Infected means there's active demineralization going on, active bacteria in the area, the tooth is soft, and then it needs a filling. Affected means that the tooth started getting decay and bacteria on it, but then the fluoride in your toothpaste, the fluoride in the water that we drink, and your and your mouthwash and everything has actually stopped it from getting worse and actually remineralized that area. So it looks like there's a black mark on your tooth, which there was decay,
But then it was stopped and
but then it stopped,
remineralized.
so it's hard. Whereas infected, you'll feel it's soft, right? But that decay that's affected hasn't broken through your enamel, because the tooth has two layers, enamel and dentine. So it hasn't broken through that. That's fine. That's a natural process that happens with fluoride that we have in our drinking water, in our toothpaste. When you go to the oral hygienist, she gives you a high concentrate of fluoride for that day. Like, that happens. But then this whole thing of remineralizing infected tooth structure that's gone. Oh wait, sorry. With infected tooth structure also, let's say it's in your enamel. I like to tell patients, let's wait 6 months before we do a filling.
Okay, why?
Because in that 6 months, if you can possibly make
So-
it'll become affected. It'll remineralize. If it's
So you'll
in the
basically
enamel.
just clean the tooth properly.
No, I won't do anything. You just need to brush your teeth properly, go to the hygienist, everything like that. Like, do the normal.
Yeah.
And in 6 months' time, that infected decay that's on the tooth.
Might have become affected if it didn't get to the dentine.
Yes, but then once it's if in 6 months' time, even if it's still in the enamel and not in the dentine, then I'll put a filling on it. Because you don't want to just take away tooth structure
Yeah.
the whole time. But a lot of dentists, they will, again, give me a lot of shit for saying that. They can say that, but at least I know I sleep at night.
Okay. That's an important thing.
Yeah, and give my patients the main thing, because that decay in 6 months' time isn't going to become anything severe. All it's going to be is that it might go slightly deeper past the enamel into dentine, and then you need a filling anyway. So it's like, if you just wait 6 months,
Yeah.
they might not need a filling.
Where I suppose that the counter argument would be if you wait 6 months and you really treat it very poorly, that you might destroy so much of the tooth structure. Right, but
It won't get that severe. And 6 months won't be a big difference. It's still a filling in your mouth.
yeah,
Yeah, size wise, it'll be very different. And then yeah, but wait. About the remineralization thing. It will. I've seen these videos. It's something that they're doing in Asia. So, and you get it. I even get it, and then I always report them for being illegal.
okay. So these are not things that can actually be done at the moment.
It's things that the people are researching in. Yes, it's definitely something that could happen at some point, but no, not now. I don't think it will ever happen, because you can't. That's like saying, if I cut your hand out, let me put some paste there, and then you get another hand.
Yeah.
Like that's
You need
not how.
some salamander skills for that.
Yeah. You need to be a reptilian or something like that. Like, you need to be weird. Like, how do you have broken tooth structure and put something on it to unbreak it and make it normal?
And grows back. What does that?
What does it grow back? Like,
So I figure out the sort of the DNA of the tooth and understand which tooth it's supposed to be,
which tooth
and
it
then
must look
it's
like.
got
It's
to
like,
grow into this shape.
if you put the wrong paste in, then all of a sudden you got a dick growing out of your tooth. You know what I mean?
Yeah.
It's like, if they could do that for a tooth, and a lot of people are getting these teeth things. A lot of my patients will come to me. Oh yeah, don't you have this? I read about this. I heard that, and then it's like, if there's so much science going into this for a tooth, why aren't they doing this for like organs and stuff and like limbs? Like, a tooth is kind of on the lower end of the scale of how important this DNA regenerative process should be. But then why is everyone getting information about this?
Oh, because you don't get to see your spleen in the liver
Yeah.
in the mirror.
Yeah, it's like it's such a it's so weird for me as to how big of a deal it is. When I'm not saying dentistry is on the lower end of the scale, but if you have a cavity but you have liver cancer, I think maybe just swallow the liver cancer first.
Yeah. No, it's interesting. I think there's a lot of money, as you know, a lot of money in teeth and in specifically in sort of aesthetic adjustments, right? I mean, I think obviously there's an important practical now. We've talked about that quite a bit, I think. But like you want your bite to be proper so that you can chew your food properly and so that you can have a good, healthy life. Floss, keep your gums healthy, keep the bone density right, all of that. But then there's this whole other part of just look pretty.
Yeah.
And I suppose there's a ton of money in that side.
Yeah. The whole looking pretty thing it's a major deal. Obviously, psychologically wise, it changes a person's life. But the one thing that I do have qualms about in dentistry is that, like I said, dentists are doing this aesthetic work without fixing
The
the
fundamental.
fundamental problems.
So someone gets to look pretty, but it's picture of Dorian Gray.
Yeah, it is just not gonna. It like, how do you fix someone's smile? Charge them, let's say, ballpark figure. It's overpriced, but let's say 100,000 rand. Okay, to fix their smile for something that's gonna last 5 years. So that's 20,000 rand a year. Not a great investment.
And also by the time that you'd run into trouble, then because
It's a big fuck up.
now the problems have become much bigger because the underlying issue wasn't addressed
Yes.
properly. So now the bone has receded further. Now it's even more difficult to.
To save.
Yeah.
Yeah. So that's where it's like, it just makes no sense. And that's what happens if you take a shortcut and try go for the quick fix.
Like Turkey or.
Turkey, yeah. I can't talk about it because it's a patient of mine, but I've had a big issue with someone had worked out in Turkey, and then it was a lot cheaper. Like honestly, like maybe less than a third of the price, including flying to Turkey and stuff. Like,
Oh wow.
and 1 year later, it's just it's a massive mess up.
Yeah, that's no fun.
Yeah. So it's like, yeah. Yes, you can get it done cheaper and stuff like that, but the fundamentals need to be followed first. Like,
Oh, that makes sense.
even when I was working at practices that we were doing medical aid and we were charging cheaper prices, I was never the one that pushed numbers. I would still do things by the book. Which there are a lot of dentists are like that. A lot of my friends are like that, where even
Make
though
sure you can sleep well at night.
yes, the main thing is, as long as you can sleep well at night and you know you've done so good, no one can complain about you. Like, I know I've had complaints about me, a lot of negative feedback that's happened, but I know what I did was right, so it doesn't stress me out.
Yeah.
Like, not everyone will find you a nice guy or a nice dentist and stuff, but as long as I know I was ethically correct and that I didn't do anything to harm or to benefit me, myself, then who really cares what you think?
Yeah, you can only do what you can do, right?
Yeah.
Yeah. So, in terms of technologies that are changing and so on, obviously, sort of everyone's talking about LLMs and how AI is changing the world and what they're. Are you using that in dentistry at this point?
So there's quite a few things in dentistry right now that's available. That is actually quite cool, especially with our 3D scanners, intraoral scanners. So Back in the day, they used to use that paste that used to
I
gag
remember
the shit out
that.
of you. Yeah. You feel like you're on one of those OnlyFan pages. No, so they have that now. We actually use a 3D scanner. How 3D scanners have evolved now is they're using AI to actually pick up the way that you scan, and then pick up images and stuff like that, and then also the AI learns what color your gloves are and then takes it out if it is in the picture and stuff like that. But that's all old news. That's been going on for years. The new thing is diagnostic ability. So in your X-rays and your CBCT, your 3D scans and things, AI is picking up all the information and then showing you with different colors as to where infection is, where this might be a cavity, this might be that stuff that we as dentists
Like major diagnostic advantages because of the amount of data that it's
yeah. Well,
trained on.
I'll say it's not the diagnostic advantage changes from clinician to clinician, but it saves time. Whereas normally I'll have to go through an X-ray and then get there. Whereas this now will already highlight areas, and I can choose like, okay, does that really mean anything, or does that mean anything? Like that time is just so much quicker.
Makes a big difference. Yeah.
Yeah, so it's less stress on you also if you miss something.
Yeah, because it's showing
picked it
you
up
the
already.
things.
Yeah. But the main thing that's happening now is something called ProClinic that it's not anything. It officially hasn't really been launched as yet. My friend Dr. Louis Trichard is working on this. Is one of the founders. It's a AI dental management system. I think that's the best way I can describe it. It's called ProClinic AI. What it's going to do is just streamline the entire admin side of dentistry for dentists by using AI technology. And yeah, it's there's so many parts to it. I barely understand it, even though he's been talking about it to me every week the past couple, like all the time. It's what it does now. It's his main focus on why he wants this is to have a transparent relationship between practitioner and patient. So what it is, it records your entire conversations with the patient. Then it'll make it into notes. It'll generate treatment plans for you. It will then use those treatment plans that you still have to accept each step. Use that, then it will
Auto reminders. And
no, it'll design the quote for you. It'll design referral letters for you, but automatically. You don't tell it anything. It just knows this from the conversation that you had. It knows who to send it to. Then it will do the billing for you. It will send the SMS to the patient to pay. So like by the time the patient comes out of your room and goes to the front desk, they have all the information that they need. And then it also sends a report to the patient as to what the dentist said and what the treatment planning is, and what their
that's pretty cool.
and what their different choices are. And it also has an inbuilt system that reads your X-rays for you through AI.
Yeah.
And it's a very multifactorial.
So I think you said it's not quite done yet. So for when it is done, or for whatever they've got in terms of social media or webpage or whatever else, just give it to me afterwards, and we'll put it in the description, and people can go check it out.
Yeah. I think I did say I sent it to you on Instagram.
Did you? Okay.
Yeah.
Cool.
So then you could just, because I'll say like they're in beta testing now, but if any dentist is listening to this, I will say apply for the beta testing, because you get a lifetime membership.
Ooh.
Yeah. Louis has to accept you as a practice and practitioner, but if he accepts you, then you get a lifetime membership, which is not going to be cheap.
Lekker.
Yeah, so it was something like it reduced our admin time as like a whole clinic. your admin time by something like 30-40%.
That's a big number.
No, it's a massive number.
Yeah.
It's a ridiculous number.
So it enables
And
all
it's been
kinds of other
proven.
things.
Everything's been proven. Like, the only thing now that needs to happen is the beta testing of the actual program before it can be released into the public. And there's multiple patents involved in it, multiple legal systems that have all been kind of approved. Been approved in Europe, America, South Africa.
Sounds exciting.
No, like, I'm not sure if you can hear in my voice as to how like my entire mood has changed, because I'm very excited as to how this is gonna
Excellent.
change the game of dentistry. But the what I love about what Louis has been saying the whole time is, screw the 40% and like how much more time a dentist will have. The patient now knows everything that's being done. And that's the main thing, is that patients don't know what's being done in their mouth, and they can never go back to what was said. Whereas now everything is open book. So
I like that idea.
As a dentist, you can't now cause cock.
Yeah. So forcing that.
Yeah, because even part
clarity.
of the AI, if you say you tell the patient you want to do a treatment plan, the AI will tell you, are you sure you want to do that? Because that sounds dodgy.
Yeah, this doesn't sound like the right course for this.
Yeah, but you can override it as a clinician, because obviously sometimes things will be over, but it'll still be in the notes.
That is very cool.
Yeah.
That does sound like the future.
Yeah, it is the
Presh, sorry, I'm just aware of time. I think we sort of run out of that.
Oh, okay, yeah.
But thank you very much for coming on Dan.
No, thanks so much for
appreciate it.
Dan. It's been great being on here, yeah. Like